Hi, my name is Ben Prince, and I'm an allergist immunologist and an assistant professor of pediatrics at Nationwide Children's Hospital, The Ohio State University in Columbus, Ohio. I want to talk to you a little bit today about oral food challenges, and I want to focus on what an oral food challenge is and kind of what you might expect on a typical day of getting an oral food challenge in your doctor's office, as well as why they're so important to be performed on a regular basis. So the gold standard of making a diagnosis of food allergy is actually an oral food challenge. In a patient that may have had an adverse reaction to food and you're considering a diagnosis of food allergy, you first want to take note of the patient's history. This is very important. You want to take specific note to what food was particularly ingested at the time of the reaction, what symptoms the patient experienced, and the timing of those symptoms. When symptoms and timing of exposure to a particular food might be consistent with an IgE-mediated food allergy, you can do further studies, further tests, such as skin prick tests or blood-specific IgEs to the food that might be implicated in the reaction, to get a better sense of how likely that patient is going to have a recurrent onset of those symptoms upon a future exposure. I want to point out that the testing, both skin and blood, do not predict anything about the severity of the reaction, and that reaction can actually be as mild as hives or as severe as anaphylaxis that can be life-threatening. And this is where oral food challenges come in. So in a patient where the history and the testing cannot confirm to a significant amount or a significant percentage that patient has a diagnosis of food allergy, an oral food challenge should be performed in the office. Oral food challenges are also important in evaluating whether or not a patient has outgrown a particular food allergy. This can vary depending on the food that is implicated in the reaction, and each food has a different natural history. So those are all important things to consider when considering whether the patient has outgrown a food allergy. When the decision to proceed with an oral food challenge is made, typically the patient will come into the office, and it's simple enough to give increasing amounts of the food that you're evaluating in the office, usually divided out into 4 to 6 dosing amounts, starting with somewhere around 1 to 5% of the food, and then giving increasing amounts, usually with a range of 15 to 20 minutes in between serving doses. The main goal of the food challenge is to feed a normal portion for that child or adult of the food in a safe way. And that's actually why we start with such a small dose, because if the patient is going to react, we want to make sure that we give them the smaller amounts first so that you would avoid a more severe allergic reaction. Typically, patients will be asked to avoid antihistamines and other medications that can sometimes mask early symptoms in order to make that food challenge even more safe. At the end of the food challenge, if no symptoms were experienced by that patient, they're usually going to be observed in the office for another hour. And I would like to point out also that most IgE-mediated food allergy reactions typically occur within 1 to 2 hours from starting to consume the food. Oral food challenges are very safe, and the reason why we do them in the office is so that you have access to important medications, such as epinephrine, to treat that reaction should it occur, and then know whether you are or not allergic to a food. When looking at the quality of life of patients going through oral food challenges, it's actually interesting to note that most patients leave actually with a higher quality of life. They feel more satisfied because they know that they either do or don't have the food allergy, and they know what to expect, especially if they've never had a symptom or experienced an adverse reaction to a food previously, and we're avoiding foods because of just testing alone. One final thing to note why oral food challenges are very important and should be performed in any patient that you are questioning the diagnosis is because we want to get foods into patients, not only to make their diet more diverse and have them have a higher quality of life in what they can and cannot eat, but also we know that studies have shown that strict avoidance of foods can actually induce a food allergy to that food. So we don't want our patients to be needlessly avoiding foods that they are actually not allergic to. If you have any questions about any kind of oral food challenge procedure, or if you're wondering whether you might have a food allergy, I would encourage you to go talk to your allergist immunologist or talk to your local physician and see if something can be done as far as whether you might need to be evaluated for a food allergy in general. Thank you for your time.